Hi, this is Don Casey, and thank you for listening to DS Tunes.
Ladies and gentlemen, you are listening to DS Tunes. My name is Anna Bruns, and I will be your host today. Dentists and their patients are increasingly concerned about the risk of infection with COVID-19 in dental clinics, owing to the generation of virus-containing aerosols through dental procedures. Today, I have a pleasure to talk to a dentist and Vice President Clinical Affairs, Consumables and Dental Supply Sirona, Professor Dr. Rainer Seemann. Rainer will share with us his knowledge about aerosols. Hi Rainer, it's good to meet you virtually and thank you for your time. How are you doing today?
Well, I'm very good. Thank you very much, Anna, and I'm very happy to be here.
Rainer, the first question, what is aerosol and why is this such a hot topic?
Well, aerosols are, technically speaking, a mixture of very small liquid particles and a gas, under these circumstances here, air. This together creates some kind of fog or mist. And dentists are producing these aerosols by using their handpieces, high-speed handpieces, or ultrasonic devices. And this is nowadays a really hot topic because of COVID-19, and especially because official agencies such as the American Dental Association or the British Dental Association or also the German Dental Association are asking the profession to reduce these kind of aerosols.
But can the coronavirus be transferred via aerosols?
Well, currently we don't know this for sure, but of course we should take it into account, I would say, and it's of course theoretically possible. But at the current stage, with the current knowledge, we would definitely need further investigations. I would say currently there's no true scientific evidence. It's more a speculation that the coronavirus can be transmitted and can cause COVID-19 traveling via aerosols. But there are, of course, a couple of things we really know for sure.
And what is it? What do we know for sure?
Well, what we know for sure is that the transmission of this virus is happening mainly via large droplets rather than by small droplets that you find in an aerosol. So these large droplets that can't travel so far are being produced by coughing, if you get in touch with saliva, by spatter that is being produced during dental treatment. These large droplets then can be transferred via many ways in the dental setting. So that can happen either indirectly or directly. Directly means from person to person, and indirectly means via contaminated surfaces in the dental setting. A good example of that is a really, really old movie that initially came from the University of Pittsburgh that was called If Saliva Was Red. And what the investigators there did is to demonstrate to their students how this works is they simply added some dye to the saliva of their patients, and then they could see how spatter and saliva traveled through the dental office during treatment. And so in other words, what we really know is that the most predominant way that this virus is being transmitted happens via these droplets and spatter.
And can you, as a dentist, tell us what can we do to protect the patients?
Well, it's not just about the patient. I mean, the patient, in order to protect the patient, here we were speaking about so-called cross-contamination. Cross-contamination means that if you use an instrument on one patient and if you use it again on another patient, that viruses or other infectious microorganisms are being transferred from one patient to the others. It's also about the so-called dental healthcare provider. So the dental assistant, the dental hygienist, the dentist. And the good news is that the dental profession has learned to successfully deal with these kind of infectious threats. So this, I remember a time when I was a young dentist that when the HIV virus became obvious or became known, that we definitely changed dentistry. And these kind of procedures are now known under the term universal precautions. So this is the basis to protect our patients and to protect the dental healthcare professionals. So this includes, starts with sharp safety, safe injection practice, disinfection protocols, personal protection equipment such as masks and goggles, hand hygiene, and so on and so on. And as I said, the good news is that the dental setting has learned how to deal with that, and we should definitely not panic. Dentistry has definitely learned its lessons from other viruses such as HIV and also hepatitis.
Yeah, that's good to hear. We dentists already experience and know how to deal with this, right? And infection prevention is just not a new concept because of COVID-19, right?
That's exactly true. So this is why it's also called universal precautions, because they're definitely universal, because you should treat every patient as if the patient would be infectious.
You have mentioned a lot of measures. Do they all help against aerosols?
Well, you could say in principle, yes, but aerosols are also a kind of special animal here. And of course, an aerosol can also contaminate surfaces, and therefore all the disinfection measures come into play. And of course, also the what is called PPE, so personal protection equipment, comes into play. Generally, you can say managing aerosols consists of three parts, I would say. One part is to protect yourself, so the dentist or the dental healthcare professional is using these PPE measures, disinfection measures, hand hygiene, everything we mentioned already. And the second thing is definitely to manage the aerosol by reducing it. And the main instrument here is the so-called HVE.
What does HVE stand for?
HVE is like, we use these acronyms all the time at dentists, so I apologize for that. Now, HVE stands for high volume evacuation. Basically, this is something very simple. This is kind of, you can say, a suctioning device that is used to evacuate air and liquids that are being produced in the operation field.
And this high volume evacuation system can reduce aerosols?
Oh yes, it can. If it's applied properly, we know this from studies, you can reduce the aerosol by more than 90%, I would say. Yeah, and if you combine that with, especially when you work as a dentist in a technique that is called four-handed dentistry, so if you work with a dental assistant, then this works very, very well. But also there are solutions for dental healthcare providers that usually work alone, like dental hygienists. And a good example is, for instance, our PureVac HVE.
Yeah, that's true. But I also heard that our other devices, other high volume evacuation systems, they can also enable evacuation of fluid and debris with 90% of aerosols. So what are other advantages of PureVac HVE?
You're right, Anna. So the statement that aerosol is being reduced by more than 90% is true for HVE in general. One of the main advantages, though, of our PureVac HVE is that it's not just an HVE tip. It also has a little mirror on it, and this mirror basically comes with the effect that it's not just evacuating fluid and debris. But at the same time, it can be used for retraction, for better visibility, and also for illumination. So you have a better sight or better vision in your operating field.
Is there anything else that dental healthcare personnel can do to protect themselves and the patients?
Yes, you're right. I mentioned just two things when managing aerosols. There's definitely a third thing. And you see more and more studies, maybe also because there's a high level of interest around COVID-19 right now, but you see more and more studies showing that it might be beneficial to sanitize the oral cavity before you start working, which means you ask the patient to rinse with an antibacterial, or in this case, antiviral oral rinse. This also reduces the risk of creating infectious aerosols. And there's one very, very important thing here, and this is there's one way of doing the right things, but it's sometimes even more important to do the things right. So if you have the right measures in place, you also have to know how to use them. So for instance, how to put on and off your personal protection equipment, how to do the disinfection measures in the right way, and so on and so on. So the list of that is endless.
So what you meant in general, like to know how to, that's the education, right? The proper education. So where can the personnel get the proper education?
Yeah, you named it. Education is really key here, and at this point, and this is exactly what I meant, that the dental healthcare providers have to know exactly how they use all those measures correctly. And well, there are several ways of having access to these kind of information. It all starts with those official agencies such as American Dental Association or the Canadian Dental Association or the British Dental Association, and so on and so on. And they mainly tell you which kind of measures you should put in place. So more or less they give you the guidelines, and then but also, of course, they also tell you how to use this correctly. But you can also get this kind of education from us. I just want to highlight here that when all those lockdowns kicked in, we more or less focused with most of our education on online education. And it's amazing that since mid of March, we had more than 100,000, and I repeat that, more than 100,000 people signing up for our online events. And the country, the town I was born in just had 2,000 inhabitants. So during that time, I couldn't even imagine having seeing 100,000 people at one place. Yeah, no, it's really amazing. And it's what's also amazing is the top 10 among all those online CE events were events that were dealing about infection and prevention. I think one of them already had 1,500 participants, and I think this re-emphasized the importance of what I described as doing the things right.
So following all the measures, aerosols should not be a problem in the dental office?
No, actually it should not, because you can mitigate the risk that we talked about earlier. And the other thing is there's truly no real alternative in dentistry. So if you take a look into prophylaxis, or if you take a look into restorative treatment, there's not a true alternative. I mean, we can go back, of course, in dentistry to just extract teeth, but if we want to do restorative dentistry, we need burrs, and they produce an aerosol. And the other aspect is that you cannot completely switch off a risk. You cannot just turn it on and off. So it's always a mitigation exercise. And also here, I would like to give you an example. If you take, for instance, hand instruments, this is nowadays, you read this very often, that people recommend hand instruments instead of ultrasonic scaling. And in fact, even those hand instruments are not completely risk-free, because they produce a lot of spatter, they produce a lot of droplets, and so on. And what I said earlier, this is the most predominant way of transmitting these kind of viruses. And the other aspect is that we, for instance, know from a clinical study that ultrasonic instrumentation in the treatment of periodontitis leads to better clinical results compared to hand instruments. So in other words, you are in a kind of dilemma as a dentist. You want to offer the best possible treatment to your patient. You can't avoid these aerosols. So in other words, you have to mitigate the risk if you want to be successful. You do this in a kind of, I would say, multifactorial approach.
What do you mean by a multifactorial approach?
Well, maybe I can give you a very simple example on that. And as you know, I'm based in Germany. I'm German, and we Germans, we love car examples. So nowadays in our cars, we have a lot of safety measures. We have a safety belt. we have an airbag. And now we also have all these sometimes annoying electronic helpers like lane assistant and brake assistant and so on and so on. And it's similar in the dental office. So you combine a lot of aspects, and that makes the whole thing safer and more successful. So you have your personal protective equipment that we already mentioned. We have disinfection protocols. We have sterilization. We have proper HVE. We have, and sorry, I could go on like that. And this all together minimizes the risks, and this is what I mean with multifactorial.
Do the dental offices have to install negative pressure rooms now?
I think, honestly speaking, it might be a little bit too early in the game to have a final answer on that, because we don't know everything yet. But I'm very, very sure that a lot of people now jump on this topic in the current situation in order to create some panic and maybe also to make a business. And can I give you really my personal view on that?
Yes, of course.
Thank you. Because personally, I think, because this is also together with a kind of gut feeling, my personal feeling tells me the dental setting definitely already has a lot of experience to deal with these kind of situations, and adding things like negative pressure rooms or so would be, for me, a little bit over the top. And now maybe coming back to my car example, for me this would be a little bit as if we would all have to wear motorcycle helmets in our cars when we drive to work. And again, coming back to my personal opinion, I always think fear has never been a good advisor. And so I think we should do well what we already know to mitigate the risk. And of course, on the other hand, we also should continue to produce scientifically sound facts.
Thank you so much, Rainer, for your insights. I have learned a lot, and I have to say, after our interview, I'm not afraid to make an appointment at my dental office. So thank you so much for sharing your knowledge.
Thank you very much, Anna. It was a pleasure. Even if it would have been, of course, much nicer to meet in person and not to sit in front of my computer. But we will get over that.
Hopefully very soon. Thank you, Rainer.